Glad to have you back on the big story this morning, and we'll be talking about the recent diphtheria outbreak in Lagos, treatments and prevention. The recent diphtheria outbreak in Lagos, the treatment and prevention. Well, today on the program, I will not be doing this alone. Of course, I have Dr. Chidima Mogo here with me this morning. She is the PRO Nigeria Medical Associate, NMA Delta State. Glad to have you here, Dr. Chidima.
Good to be here. Thank you for having me. Good morning.
All right, good morning. So the Lagos state government has confirmed 14 diphtheria cases among pupils of King's College Annex, Victoria Island, Lagos, with one reported death. Commissioner for Health, Professor Akin Abayomi, confirmed the cases during a visit to the school yesterday. Abayomi said the outbreak had been ongoing for over 10 days before it was confirmed. He said the affected pupils were receiving medical care with 12 administered antibiotics and diphtheria antiserum. And while addressing parents' concerns, he reassured them that the government was handling the situation and advised against withdrawing their children from school, warning that this could make containment more challenging. And in response to the outbreak, the state government has started a mass vaccination campaign targeting pupils and staff members at the school. However, only pupils with parental consent will receive the booster dose. So, Dr. Chidima, let's get to understand diphtheria better. What exactly is it and how does it spread?
Okay. Diphtheria is a bacterial infection.
Okay.
So it affects the respiratory tract. Okay. And it is caused by a bacteria known as corrine bacteria diphtheria. So I may not bore you with all that scientific name, but that's the name of the bacteria that causes it. So it's like we said, it affects the respiratory tract.
Yes.
That means the major spread is through air droplets. When someone who has been infected with the bacteria coughs or sneezes or even talks,
Yes.
or when people touch their personal items, like for instance, the infected person uses a piece of tissue,
Yeah.
and someone else touches the tissue. So the person is at risk of contracting if he or she uses the same hands, maybe to pick his nose, rub into his eye, or something like that. So that's just the way it spreads from one person to another. And also it's worse in overcrowded area when, let me say, a lot of people are there, people that are infected are there talking, coughing, and all with no etiquette. So the spread will be there.
Okay. Now let's talk about the early symptoms and how people differentiate them from common throat infections. You just talked about it spreading through air. We have so many other infections
Yes,
that
exactly.
spread through that means.
So the symptoms include, just like any other respiratory tract infection, there will be fever, there will be malaise, that you feel sick, there will be chills, Then when it comes to respiratory tract, we have cough, person will have cough, sore throat, difficulty swallowing,
Yes.
difficulty, pain swallowing. You also have weakness or tiredness, all right? Then there could be redness, there could be swollen lymph nodes that will lead to redness of, you see the area. That's one typical thing about diphtheria.
Okay.
The lymph nodes around the neck will be swollen, all right, because
So
of that
it's swollen
infection.
and you can
Yes,
actually look at it and you see it
it's
is
a redness,
swollen.
a little bit, you see some form of redness in that area. So that's one typical thing about, and that's when it has advanced, okay? So that's just it. Then you can also have runny nose, all right? So these are just the common symptoms of diphtheria.
Okay. Now that we've talked about the symptom, let's know if there is maybe anyone who is at a risk of severe complications or at a more risk of complications from diphtheria.
So, well, children, of course, children normally and elderly people, their immunity is usually low, so they are at risk. And people that live in overcrowded regions,
Okay.
people that don't, they live in insanitary conditions, maybe where they don't have good practice of hygiene, all right? So those people are more at risk.
Okay, now with the outbreak in King's College in Lagos, now can we say this is sort of a sanitation issue? Maybe the environment wasn't clean enough or it wasn't properly vaccinated enough. That's a boarding school and everyone's supposed to be
Yes.
kept clean. But you know how boarding schools can be. So could it have been maybe a sort of a sanitation issue?
Well, that may play a role, but I think in this case it's more of I'm not saying the school is overcrowded, but boarding school, that the children are there, right? They are more like in a fixed area. Do you get? So,
Okay.
like a lot of children being there in area could have played a role. Let me say in a room, maybe someone has been infected and they are in their room. You know how boarding houses can be.
Yes.
So all the roommates are at risk, right? And then they will now go and meet other students in the classes, and the chain of spread continues. So that could have been that.
Okay. Now, to control this, we hear that there is a vaccine. Is that correct?
Yes.
So you take the vaccine and you can't get infected even when you stay close to someone who has been infected.
Yes, your risk reduces. Your risk of being of contacting it reduces, because this vaccine thing. Well, vaccine plays a major role, right? If you're vaccinated, your risk and chances of getting infected reduces a lot. But the thing is that it's not like 100%. Let me put it that way. But it
Okay.
has because you don't know. Sometimes there's something we call vaccine potency. That's why when they give vaccines, we advise that you should make sure the vaccines are well preserved in the right temperature, because if you don't do that, these vaccines lose their potency. So people are coming to get vaccinated and you feel that, oh, they've been vaccinated, not knowing that they got something that is not so effective. But that aside, vaccine plays a major role in prevention.
Okay, so let's say on a scale of 1 to 10, how effective is vaccination when it comes to diphtheria?
I will give it 8.
It's at 8.
I can give it an 8.
Okay. Okay. So do we have it available here in Delta State, the vaccines?
Yes, the vaccines are available. It comes as a combination, or it comes with, tetanus.
Yes.
Yes, it comes along with tetanus and pertussis. Pertussis is whooping cough. I don't know if you know about whooping
Yes, I
cough.
know whooping
So
cough, yes.
they come together like the combination of diphtheria, pertussis, whooping cough. So they are available.
Okay. So when someone first notices that or suspects that they have diphtheria, what do you think should be the first thing that they should do?
Well, what we always say is, if you're sick, go to the hospital, see a doctor for appropriate treatment. All right, don't do self-medication, because you might just feel it's ordinary cough. You might just feel it's maybe the symptoms include fever, sickness,
Yes.
hair. So you might feel it's malaria and you just be treated, or probably because you have cough, just go to a patent medicine store, a pharmacy, just get medication and start taking. So we always advise go to the hospital for appropriate history taking, examination, do the necessary investigations and treatment. So go to the hospital.
Okay. So the treatments, what sort of treatments is used? We've already talked about vaccination. So say someone has been down with diphtheria, what is the treatment like, and how long before it wears off? Is it really that deadly?
Well, it could be deadly when it's not like tackled on time.
Okay.
That's why I say early diagnosis and treatment. That's why most people present when the situation has gone very bad. So that's why we advise, anytime you're sick, go immediately to the hospital for appropriate treatment and management. Okay, so when you present on time, the doctor examines you after getting your history. He does the necessary investigation, confirm the diagnosis. Then there is treatment, give necessary antibiotics and all you need for it. So it's treatable. But when you get to the advanced stages,
Yes.
so we can't really guarantee survival.
Like how
So
long before it gets to the advanced stages if it's not
well,
properly tackled?
when the person has deteriorated, when it has started, complications have set in, started affecting, because it can cause, but it has complications of, like, it damages the heart, the kidneys, the nervous system. So that could, I didn't mention that diphtheria can come with difficulty breathing.
Okay.
Yes, shortness of breath, all right. So that's in the advanced stages. So when the person is now presenting very late, it could be, we know we have a recorded death in Lagos,
Yes.
in the school. So it could be that the child, everything wasn't noticed on time. The child would have presented when complications have set in, and maybe there was little we could have done or they could have done to save the child. So
Okay, but the treatments for diphtheria, is it available in places maybe like Delta State, even though that there's been no
yes, it's
outbreak?
available.
It
Yes,
is available.
yes, the treatment is available.
Okay, and then are there things that we could do now presently? Because I mean, this is just Lagos State and it's just a few hours away from Delta State, and
Yeah.
there's been an outbreak, there's even been death. Is there anything that's been done presently to raise awareness and things that people can do to curb the spread?
Yes. This TV station is already raising awareness, and I
Okay.
give kudos to you all. So that is it. People listening in will know that, okay, oh, we have this around, we have to start doing something about it. So things that can be done to prevent it, right?
Yes.
So number one is cough etiquette, right? What do I mean by cough etiquette? We preach that, or we advise that if you want to cough, do not cough into your hands.
Okay.
Cough into your elbow or into a disposable tissue, right? So you just cough into the tissue and discard it, or you cough into your elbow. Because if you cough into your hands, you do a lot with these hands.
Yes.
You touch people, you touch surfaces. Let me say someone that is infected with diphtheria coughs into his or her hands and, uses it to open a door. The infection is now on the handle of the door. Another person could go touch the same handle and maybe use the same hands to touch his or her any part of the respiratory system here. And that's how it could spread. So what will cough etiquette is one. Then hand hygiene. Wash your hands regularly. If you don't have water and soap readily available, you can use an alcohol hand drop. That's hand sanitizer.
Okay.
So that is it. Then another thing, let's avoid overcrowding.
Okay.
All right. Then if you're sick, go to the hospital for treatment. Then if you're coughing and you're coming to like where a lot of people are, try to wear a face mask. Or maybe you're in an area where someone is coughing around you. You can also decide to put on a face mask to protect yourself. Okay. Then also the vaccination. People should get vaccinated. It's part of the routine vaccination for children, like from birth and all. I think they get it from 6 weeks of age. So parents should ensure that they take their children for vaccination. There are booster doses too. Go for booster doses. Even adults have booster doses. Even it can be given, shot can be given to even pregnant women. So vaccination is also key. There are some people that may be infected, but they may not have signs and symptoms, probably in the early stages of the infection or the disease. So, but those people can actually spread the bacteria.
But avoiding congested areas is something that's going to be quite difficult in Nigeria. I know how the marketplaces are, even public transport and all of that.
Yes, it's
classrooms, yes, workplaces.
So that is just it. But what we can do is, well, if you're practicing hand hygiene, or in the marketplaces actually, people stay in their different stalls.
Okay.
Like everybody has their own space and all. So unless probably you're a buyer, you are the one infected, or the market woman is the one infected. But I feel in that case, that short period of time, much may not have dropped, just in case it happens. Once you notice any unusual signs and symptoms, just go immediately for treatment. Yes,
okay, so treating immediately is also a way to maybe prevent
it. Then getting vaccinated. If you're vaccinated, you're covered to a large extent.
Okay, so what if it starts and then someone just starts treatment immediately? Does that mean they can no longer spread it? And how long does it take for it to just succumb to the treatment?
Well, immediately.
Okay.
Yes, once treatment is started, let me say the amount of the bacteria or the bulk of it is reduced. Let me use that word.
Okay.
So it's effective. So that's just it.
All right, but are there any other steps that the government, particularly here in Delta State, are taking to control the outbreak yet? I mean, do we have to wait till the last minute to get a reported case before?
No, we can't. I think there's already awareness, like sensitization, because knowledge is power. Or I would say applied knowledge is power. So people have to know. So we can start like our radio jingles, TV, sensitization, right? Flyers, billboards. These are things we can put in place to educate the public and let them know that this is available, this is with us, and these are the things they should do in order to protect themselves and their loved ones.
Okay. All right. Is there any other thing you would like to add on diphtheria before we move on to the next discussion this morning?
So I would say that vaccination is key in this fight against diphtheria. Get vaccinated, because you can't, say who you will come in contact with. So, but when you're vaccinated, you're covered. And then practice hand hygiene, practice respiratory etiquette, and keep your environment clean. Avoid overcrowded areas so that you will be protected.
Okay. Thank you. We started earlier by talking about the case in Lagos, and so many persons were shying away from vaccination, not wanting to get vaccinated, and all of that. What can you say about that? That at this present day, people still don't want to get vaccinated or get involved with anything that has to do with vaccination?
When it comes to diphtheria, the vaccination is not new.
Okay.
If it was, I know during COVID time, people were skeptical about it because it's new.
Yes.
Like something else coming up, and there were a lot of controversies around it. But diphtheria vaccine has been with us.
Okay.
It can even come as a combination of only diphtheria and tetanus. So it's not something new. So I feel like, well, I don't know the level of education of the parents. Well, it's not even about a level of, because even people that are well educated still
Yes.
have that
Yes.
reservation. So I feel more sensitization has to be done, more education to convince them and let them know that the vaccine is not new and is not harmful. So if they go to the right quarters, the federal government, like the right institution, and I believe it's the federal government or the state government, sorry, that is bringing it to them. So I
Yes.
feel they wouldn't bring something that will hurt like their people.
Yeah.
So
Yes.
they should try to like trust that fact that the vaccine is safe.
Yeah, I mean, the our parents, and we did get reports of some parents wanting to pull their
Yes.
children out of the school so they don't get infected, and so many of that. And then the commissioner for health kept saying to parents, "Oh no, don't take your children out of here. It's better we know that they are all within here,
Yes.
so we can check it."
Contain the spread, yes.
Yes. So to our viewers, just know that diphtheria is preventable and awareness is our best defense. If you haven't been vaccinated, now is the time. Stay safe, practice good hygiene, and follow public health guidelines. I mean, we just outlined some of them this morning.